Well, here we are at a really exciting point in NIH history and in the advances in science that are now possible. And it's challenging to try to break them down into any subset of themes, but I tried. So one would be basic science, which is half of what we do. It's the foundation of everything that we've ever accomplished, and it needs to be the foundation for the future as well. And I, in that space, talked about genomics, but there are lots of other things I could have talked about in that area as well. And then translation. How do we take that basic science and move it towards the clinic? And what are we doing to try to speed up that process and knock down obstacles? Things like NCATS, which is our new institute, tries to do. And I particularly talked about ways that we could use tissue chips to speed up the process of testing out whether new drugs are going to be safe or not. And then the third one was this big, bold new initiative called Precision Medicine Initiative, where we aim to enroll 1 million Americans as our partners, not patients, partners, in an effort to figure out what are all the factors, genetics, environment, health behaviors that play out in health or disease in an ongoing longitudinal way. I've never tried anything quite this big. It's pretty scary to imagine standing it up, but we're going to stand it up this year. And then fourth, the new initiative just announced by the president and now led by the vice president, the Cancer Moonshot. How are we going to bring together all of the exciting things that are happening in our understanding of cancer to speed up advances in prevention, early detection, and treatment, particularly in immunotherapy? And the president proposing no less than $680 million in this current coming year, fiscal year 17. Well, we better figure out what to do with that, and we're ready to go. And then finally, the most sort of critical part of this, the essentials for research to go forward. That means we need to pay attention to our workforce. We need to have the resources to make this go. We've lost a lot of ground over the last 10 or 12 years in terms of dollars to support the effort. We're delighted that we seem to be turning the corner in FY16, but that momentum needs to be sustained. We all got to work together to make the case that this is one of the best investments that the government makes in anything. Medical research is just a really wonderful thing to put your money into. National Health Council has been remarkable in their focus on participants as patients. And this is not just about researchers off in the laboratory figuring out what is the right thing to do. We all got to do this together. So as a partnership stimulator, the Health Council has done a great job of that. But that also means getting the case made to the decision makers about why this is such an important time and why the policies need to be right in order to be sure research advances, things like catalyzing data access so that it doesn't stay packed away in silos but actually comes out and becomes available, and making sure that the resources necessary to support that young scientist that just came up with a great idea but needs to have some way of pursuing that. It's been kind of a tough time for those young scientists for a decade. If we could turn that corner and unleash that capability, and the National Health Council is in a great position to make that case, that would really change things.